Hey guys, Dr. St. Jean here at thechicagochiropractor.com. Thank you for tuning in. In this video series, I'm going to talk about how if you reduce inflammation, you can reduce pain. And if we're all being honest with each other, I'm pretty sure you're probably watching this because you're in some sort of pain. Maybe you have shoulder pain, maybe you have knee pain, headaches, migraines, whatever it is. Keep watching, we got a lot of great information. Obviously, pain is not a good thing. Neither is inflammation. Unfortunately, the two come hand in hand most often. So typically, if you want to address pain and you want to eliminate it, then you should address inflammation and eliminate that as well. And that's exactly what we're going to talk about. We're going to talk about natural ways to reduce inflammation and therefore pain. So no surgical procedures, no injections, no medications. Everything we're going to be discussing is natural, and it's going to help you recover your health and get back to where you want to be. Inflammation is at the heart of what I do with my work. I see it every single day here in the clinic. There's never a day that we don't deal with it. Of course, we're trying to get patients out of pain, so therefore we're addressing inflammation. It's kind of like this. You cannot drive a car without keys, and you can't swim without water. You cannot treat pain without treating inflammation. So let's talk about what we're doing in terms of natural strategies to reduce this inflammation. Food nutrition is a big one. You are what you eat, so you absolutely have to consider that. Another one is exercise. We were meant to move. We are creatures of movement. If we're not moving on a daily basis, that's a problem. And if we're not able to move properly without pain, that's even a bigger problem. Sleep, we're going to talk about sleep. The importance of sleep cannot be overstated. I can't tell you how many patients will be doing everything right, but until that sleep is really dialed in, they're not getting out of pain. And then of course, last but not least, supplements. Supplements are huge. They're a huge advantage to basically expedite your treatment and get you better faster. And last but not least, I'm going to give you links to all the specific body regions that you might be experiencing pain in. Let's say shoulder, let's say low back, neck, knee, etc. And I'm going to give you a sneak peek and a perspective as to how we go about specifically treating those regions and reducing inflammation. So here's the deal with inflammation. Inflammation can both cause and result from injury or disease. It's a two-way streak, but regardless of what's going on in the inflammation area, you're always going to have pain. And that's what really stinks. That's what stinks for patients. And I think a theme that we all talk about here is that if you want to eliminate pain, you must deflame. It's that simple. For many patients, they really want to understand how inflammation actually causes pain. What's the mechanism? And the reality is they want to know why, if they're coming in here for low back pain treatment, why are we talking about nutrition? Why are we talking about sleep, exercise, things like that, in addition to what you would normally expect for low back pain treatment? Let me put it into context. Let's say you wake up in the morning, you're in a rush, you bend over to put on your shoes, and pop, there goes your back. You feel this sharp, stabbing, nasty pain going down your leg. What really happened there? What set off the pain, and how does inflammation play a role? Let me explain. So what actually is happening in your lower back? It's actually kind of straightforward. You have a bunch of chemicals or inflammatory mediators. That's what they're called. We'll call them inflammatory soup, right? Prostaglandins, tumor necrosis factor, IL-1 beta, IL-6. These are all chemicals that are made to respond to injury. They're going to go and try to help out. Think of them as paramedics, right? So they're going down to the site of the injury and they're helping out, they're trying to fix things. But the problem is twofold. Sometimes they're going to set off pain signals. So just their presence in the area is going to set off pain signals, which is going to go to the brain, and then you're going to say, ouch, I feel pain. And also sometimes if it becomes chronic or the response is too intense, that's when it becomes an issue, right? The pain signals and the chronic unrelenting inflammation. But this is basically how inflammation sets off pain. Now here's where it gets interesting. Anything that slows down this inflammation, anything that reduces that inflammation or reduces these pain signals from being set off so that the cortex in your brain can actually sense that you're in pain. Keep in mind, the only reason why you know that you're in pain is because these neural pathways are being activated. If they weren't being activated and they were being inhibited, you could still injure yourself, but your brain wouldn't be telling you that you're in pain, right? So anything that reduces the amount of inflammation at this site and reduces the transmission of pain signals into the brain is going to reduce pain. Now, conventional medicine takes the approach of medications. So they'll send right here and right here. So I'll draw another arrow right here. They'll do medications right? Medications is typical pain medications or over-the-counters. They'll do injections. My handwriting's bad, but I hope you can read it. Medications, injections, and sometimes they'll even do surgery, right? But what are we going to do? We're not going to do any of this. We're not going to do any of that. We're going to use things that are natural. We're going to use nutrition. We're going to use supplementation. We're going to use lifestyle changes. We're going to use soft tissue techniques. So different things like PIR, trigger point therapy, muscle relaxation technique, Graston. We're going to use therapeutic exercise. We're going to use brain-based therapy. We're going to use adjustments, things that are non-invasive, that do not come with side effects, that are going to accomplish the same exact goal. We're going to still reduce that inflammation. We're still going to reduce the pain signals, and we're going to do so naturally. Okay guys, we just finished the introduction video, the first video, and reduce your inflammation, reduce your pain video series. I hope you found the information helpful and useful. If you want to schedule a consult with me and get down to the root cause of your inflammation and start reducing your pain and eliminating it now, click the free consult link below and we'll get started right away. Otherwise, stay tuned for more great information and natural solutions that you can use in the comfort of your own home to eliminate pain. This is Dr. St. Jean. See you soon.